My name is Cynthia Emory, and I'm an associate professor in the Department of Orthopaedic Surgery at Wake Forest Baptist Health, and I specialize in orthopedic oncology, which is a field that specializes in different bone and soft tissue tumors of the musculoskeletal system. My clinical specialties include patients with bone and soft tissue tumors. And so a lot of patients think that the word tumor automatically means cancer, which isn't really true. Tumor just means growth. And so I see adults and kids with both benign and malignant types of tumors in the bone and in the muscle of arms, legs, back, really anywhere in the body. Sometimes when patients are scheduled to come and see me in the office at the cancer center, they receive a phone call that says, you have an appointment with Dr. Emory and it's at the Comprehensive Cancer Center. A lot of times patients get very anxious when they realize that their appointment's at the cancer center. It doesn't necessarily mean that you have cancer. That is the area where I see patients in the office that have an abnormality. It doesn't necessarily mean that it's anything that's cancerous. There we have the ability to get on-site imaging. We can do on-site biopsies in certain instances and potentially even get a diagnosis that day. So oftentimes patients and their families will come into the office and there's been several days of anxiety because they're coming into the cancer center, but oftentimes it doesn't necessarily mean that that's what the diagnosis is.